everyone, my name is Radial, first year student nurse for today. So today I'm going to perform pulse taking on Radial. So the purpose of this procedure is to determine the adequacy of peripheral circulation of pulse deficit. So the first thing you do is introduce yourself and verify the client identity. This is to make sure that the clients feel safe and to have a therapeutic intervention and to confirm necessity. So next is explain what you're going to do and why is it necessary to provide information and to foster cooperation and understanding. So you need to do this, guys. Go and move, even move straight. Okay. So next is perform hand hygiene to prevent the spread of infection. Next is provide the safety and privacy of the patient to maintain the privacy and safety of the patient. Next is flex the client's elbow and place the lower part of the arm across chest. Relate position of forearms, slightly flexion of wrist promotes exposure of artery for palpation without restriction. Support the client's wrist by grasping outer aspect of thumb to provide easy access of pulse site. The next, place your index and middle finger on the inner aspect of client wrist over the radial artery and apply light but firm pressure until pulse is palpated. The fingerprints are sensitive, better to feel the pulse. Do not use thumb because it has strong impulse and could be mistaken for client's pulse. Next is identify the pulse rhythm and pulse volume. Strength and reflex volume of blood injected against arterial wall with each other heart contraction. "30 beats per minute times 2 equals 60 beats per minute. So the radial pulse of the patient is 60 beats per minute. So the client's pulse rate is normal. Next, assessing the apical pulse. First thing you do is introduce yourself and verify the client's identity to make sure that the clients feel safe and to have a therapeutic intervention and confirm necessities. So, Lina de la Cruz, your march right. Okay. Next is explain why you're going to do and why is it necessary to provide information and to foster cooperation and understanding. So we're going to apical pulse. So next, perform hand hygiene to prevent the spread of infection. Next is provide the client's privacy to maintain the client's privacy and safety. the earpiece and diaphragm of the stethoscope with an alcohol swab to prevent spread of microorganisms and cross-contamination. The next, raise the client's gown to expose the sternum and left side of the heart. To expose the sternum, to be able to locate the apex of the heart where the apical pulse is there. Then raise the client's gown to expose the sternum on the left side of the heart. Expose the sternum and to be able to locate the apex of the heart where the apical pulse is located. Locate the apex of the heart. Place the stethoscope in the 5th ICS in order to hear PMI. Inform the client that remain silent in order to listen the heartbeat. The heartbeat is normally the loudest over the apex of the heart. For the client to understand the action and to be able to ask her to be able to remain silent. With the dominant hand, put your earpiece in the stethoscope in your ears and grasp the diaphragm in the stethoscope palm of your hand for 5 to 10 seconds. The metal of the stethoscope, the metal of the diaphragm is usually cold, so it can startle the client when placed immediately to the chest. So ask the client's permission first. So next, place the diaphragm of the stethoscope over the PMI and auscultate the sound of S1 and S2 to hear the sound of lambda. Each lambda is counted as one heartbeat. The two heart sounds are produced by the closure of the heart valve. The S1 heart sound loud occurs when the atrioventricular valves close, after the ventricles have been sufficiently filled. The S2 heart sound dub occurs when the semilunar valves close after the ventricular are empty. Note the irregularity of the rhythm. If the rhythm is regular, the heartbeat for 30 seconds and multiply it by 2. If the irregular count beats for 60 seconds. Next is start the count when looking at the second hand of the watch. Count knob dub sound and as one beat, count and rate it in a full minute. A 60 seconds count provides a more accurate assessment of an irregular pulse than 30 seconds count. Then share your findings with the client. For the client's knowledge. So minimum heartbeat rate 68 seconds per beat, which is normal. Kung normal o normal na range siya sa heartbeat is 60 to 130 beats. Then proceed your findings and record it. Then documentation of records provides ongoing data collection.